Glad that you're here tonight because we're going to talk about headache, okay, cephalgia, and I think it's an important topic. And as I was doing some more of this research and looking into it, of course we're really well versed in headache, but it's interesting to go back through the literature and learn how many things are even changing as far as the categorization and the naming of headaches now. And one of the things that we're going to talk about is not only just what a headache is, because I think everybody kind of has an idea of what a headache is, but what's really neat about this is, and I think it's going to equip you to understand headache more, not only just for yourself, but for people you talk to. It's really good for us because when people come in and they say, hey, I got a headache, if we can figure out what the classification is and where their headaches are coming from, then we can help you to understand maybe what some of the triggers for the headache are, what causes it, what makes it go away, and how chiropractic, of course, can be an integral part of helping you alleviate headaches. So we're going to talk a little bit about that. So, obviously, as you can tell, a little bit smaller crowd tonight, so it's going to be really informal. If you have a question, fire away. If you have a comment, let me know. It's okay, all right? For those of you who don't know me, I'm Dr. Ross. I've been practicing for about 10 years, and I think that this is important information. That's why I want to do a headache talk tonight. So we got a lot of stuff to go through, so I'm just going to kind of start going through it a little bit. And if you have a question, just fire away and let me know, okay? Definition, of course, first. A headache involves pain in the head or the cranial vault, which can arise from many disorders or may be a disorder in and of itself. So in other words, headache can be a symptom of a bigger problem, or it could be the problem. It just depends on what's going on in there. Approximately 40 to 45 million people in the United States suffer chronic headaches. That number kind of took me back just for a minute, you know. But I guess when you think about it, just seeing my patients that come in, how many of them talk about headaches initially is really pretty significant. It's pretty staggering. Headaches have an enormous impact on society due to missed work days and productivity losses. Recent research shows that direct costs of headaches to employers due to absenteeism alone is estimated at between $16 and $24 billion per year in the United States. Per year. $16 to $24 billion is what it's costing companies because of headaches. Now, the interesting thing is, this huge sum does not include the cost of presenteeism. How many of you have heard that term before, presenteeism? It's like absenteeism is when you have to miss work because you're staying home and you don't feel good and whatever. Presenteeism means you were there, but you weren't performing, okay? And those costs are really difficult to calculate. But if you think about it, if you were at work and you had a splitting headache and a migraine, or you had a terrible problem going on in your body and you're just not producing very well that day, or 10% of the workforce isn't producing that day, what the costs are, the aggregate costs of presenteeism are astounding. And I think that number would truly dwarf what the current estimates are. So if they're projecting $16 to $24 billion in losses just from absenteeism, presenteeism would probably be, I don't know, 10 times that. You know, if you lost an hour to work every single day of the week of every day of your life because you had a headache, that's a big deal, you know. So I want to talk about this a little bit further, but first, of course, we got to have a little cartoon action. But offhand, I'd say you're suffering from an arrow through the head, but just to play it safe, I'm ordering a bunch of tests, right? So clearly there are headaches, and then there are headaches, okay? And obviously this guy would be suffering from a whole different kind of headache. But I think that this kind of struck me funny because when people come in and they say, I have a headache, clearly we need to know more than that. What kind of headache? Did you get hit on the head? Do you have headaches every day? Were you out drinking last night? Did you, are you on a medication that could be causing this? Do you have a tumor in your head? So when people come in and they say, well, I have a headache, and I'll say, well, let's talk about the headache. I think sometimes people are like, well, what do you mean? It's a headache. But a headache to you is different than a headache to somebody else. And as we probe and try to figure out where these things are coming from, we want to know, is this directly because of your neck? Is it indirectly because of your cervical spine? Do you have a cranial nerve issue? Is there a sensitivity in your body? Is it a reaction? Is it an allergy? What's going on? And we got to try to figure this out. So this is kind of funny because, clearly, obviously, an arrow through the head would be causing a headache, but there could be other stuff going on as well, right? So let's talk about anatomy a little bit. I'm not going to spend a ton of time on this, but I want to go through the different levels of anatomy just so that you can get that way we can kind of wrap our head around what a headache is, just by knowing it's more than just the brain. There's all these different systems that are going on in there. But clearly when we talk about anatomy of the brain, when we start on the outside, of course, there's the skin and the cranial bones, okay? And everybody knows about the skull and how it's all pieced together. to protect that brain, and that's a very important job. When we get inside, there's different parts of it, but what I want you to understand is the relationship here between the outer part of the brain, the cerebral part of the brain, and then the inner part of the brainstem, the spinal cord, the dura, the cerebellum. These are important parts because the dura is like the wrapper around the spinal cord that comes down. It's what holds the fluid inside. Okay, so there's this lining, and there's actually a couple different. There's pia mater, and there's arachnoid mater, and then there's dura mater, and it's this tough lining around the spinal cord and around the brain that kind of holds that fluid inside of there, and that can be very important. If anybody's ever heard of spinal meningitis, that's where those things become very, very, very important. The different lobes of the brain then are broken down. You got the frontal lobe up front, of course, the parietal lobes on both sides, the occipital lobe, and the temporal lobes. Okay, so there's these different parts of the brain, and different parts can be affected by different kinds of headaches. And having a headache in different parts of the brain can be a reaction to different triggers. So then we get into the muscle system. Okay, so obviously, as you can see, this is not everything. Okay, there's a lot of muscles in the head. In order for you to smile, it requires a tremendous number of muscles. In order to frown, it takes even more muscles. To move your eyes left and right, there's all this interaction of different muscles, and there's all these little different strips of muscle innervated by different nerves in the body. And so you can really get into this stuff on a really big level. But this is just some of the muscles that are associated with the head, neck, face, and the upper part of the body. So again, that muscle system can be important to understand, because when people come in and they say, well, I have a headache, and I say, well, where's that headache? Is it here, here, here? Well, it's here, but then I have pain that comes down through here, and they're kind of tracing the muscle without even knowing about it. That's important information to us, because we can kind of see what reactions are happening in the body, what else is going along with this headache, what's the muscle tightness that's associated with it. Is this a tension headache, or is this a different kind of headache based on what we see? Going a little bit deeper, then you've got the vascular system. Okay, this is really important because vascular headaches are a whole other animal altogether. Okay, but when you look at the arteries and the way blood is feeding into the brain, a couple of the major arteries that you're going to have heard of, I think everybody knows the carotid arteries, right? You've heard of the carotid arteries. It's a big deal. Everybody's heard about them either through people having strokes or people having different problems or having blockage. The carotid arteries are something that you watch pretty carefully. If you're interested in it, you should be able to find your own carotid artery. Can everybody do that? If you take your fingers and just go right beside your voice box and down inside, you should be able to feel a pulse pretty easily on those carotid arteries. Okay? And you can check both sides, and if you want to do it later, you can kind of probe around in there. But if you come just off the voice box, just off the trachea on either side, and then down deep inside, just a little ways, you should be able to feel that carotid pulse pumping away inside there. Okay? The carotid arteries deliver 2/3 of the blood to your brain. Okay? So that's why it's such a big deal. If those things get blocked, if there's a problem in there, or if there's damage to them, or if they get opened up, and you see on TV how people spurt blood, on all these NCIS TV shows and stuff, there's a large volume of blood going through those arteries. They're very, very important. The other third of the blood that's coming through the brain is called the vertebral arteries. And those are really neat arteries because they come down along the spine, up through the thoracic spine, and then up into the cervical spine. They actually enter the bone inside the cervical spine. That's why we're so interested in the vertebral artery, because tension in the cervical spine, rotation of the cervical vertebra, can put tension on those vertebral arteries. Please come right on in. There's water if you want one. Make yourself comfortable. So, again, the vertebral arteries are more important from a chiropractic perspective because that's where we're working, right? So we're working in the back of the neck. We're working with the alignment of the vertebral column. But think about it this way too. The vertebral artery comes through little canals in the sides of the bone as it comes up through the spinal column, and then there's a little bit of slack at the top. It kind of bows out at the top, and then it re-enters and goes back up. There needs to be a little bit of slack in that artery, right? And the reason for that is because when you do this and you do this, it's going to pull those arteries differently from side to side. So there has to be a little slack. Think about this though. What if your spine has a curve through it and it's rotated inappropriately and it's constantly pulling on those vertebral arteries? You're going to lose some of that slack. So now when you turn your head and you get a little lightheaded, That's important. So there's all these things that kind of come into play when we're doing differential diagnosis to figure out where are these headaches coming from, what kind of headache is it a vascular headache, does it involve the vertebral arteries? This is important stuff. So the other thing that can happen is the picture here on the left is a diagram of what's called the circle of Willis. And what you're looking at there is the brain from the bottom. So if somebody lopped off my head and we opened it up and you were looking this way into the brain, that's what this is. Here's the front where the eyes would be, and then this is the base of the brain with some of it cut away. There's what's called the circle of Willis, and you can see it almost looks like a bird. Here's the beak of the bird, the body, the wings, and then the body and the feet coming out. And it's got all these different branches. The reason I wanted to show this is I want you to see this artery right here. It's called the middle artery, and that one is the most common artery for stroke. So if you ever hear somebody that had a cerebral stroke or a stroke inside their brain, most of the time it's going to be that artery, okay? So when people come into us and they say, oh, I've got this sudden splitting headache, and we'll talk about this particular type of headache. It's called a thunderclap, where suddenly you get, boom, like you get knocked out with this headache. That's something that we have to consider. Did you just blow an artery inside your brain? Because it's going to be intense pressure right away. And so these are things that we have to think about and know about inside the brain as well. So there's that circle of Willis. Again, a little bit better diagram. It shows it a little bit more. Again, it's just how that blood vasculature comes up through from the carotid arteries and from the vertebral arteries. And you can see where they come in from the carotids here, from the vertebral artery here, and come out and then feed that brain and bathe it in blood and bathe it in oxygen. Getting that blood up to the brain is obviously extremely important. Okay? Then we get into the next level, the nervous system, and this is really where our expertise lies. There are 12 cranial nerves that stay inside your brain. They originate from the brain stem and up inside the brain, and they stay within the brain. They never leave the cranial vault. They never leave the cranium until they go out to the eyes, the ears, whatever. So it's important for us to understand those, because you might come in with a headache that's demonstrating certain problems. If you've had a stroke, or if you've had a problem, a vascular problem in your brain, and then you're having certain problems like moving your eyes in a certain direction, that can be affecting certain of the nerves, or your sense of smell goes away, or something happens. It's important for us to understand how these cranial nerves affect that. The other thing that I think is important is these nerves that affect the eyes, the ears, the maxillary nerve, the sinuses, the trigeminal nerve, which is all your face, all that stuff, they don't come out of the spine. They come out of the base of the brain. However, the nerves in the spinal column feed these nerves. They bathe blood flow to that area. They have nerve correlation into that area. So this is really important stuff for us to understand, but they can definitely be an area where headaches can get involved. Okay? And then we get into spinal nerves. And again, this gets really complex, but you can see how complex the web of nerves is that comes out of the spinal column. And it branches and branches and branches like tree roots and goes to these infinite little nerve endings and sensory relationships between your neck, your shoulders, your arms, your hands. So sometimes people might come in and they say, well, I've got a headache and I've got this pain in my neck, and it comes down the back of my arm, over my elbow, down into these two fingers. Well, you just told me exactly which nerve root is causing your problems, and it may be associated with the headache. So all of these things start to play together when we follow nerve roots and kind of determine these pathways of the nerves. So this is a key thing for us to remember right now, is we're going to talk about headaches. But as you can probably understand, in a chiropractic setting, we're going to talk about headaches, we're going to talk about nervous system, we're going to talk about how we deal with headaches and how we can help you control headaches. But remember, the nervous system is the master controller of your body. It is either in direct or indirect control of every function of your body. If you have a headache, is your nervous system involved? Yes. If you have a stroke, is your nervous system involved? Yes. Even though that's a vascular issue, your nervous system is going to be involved, because that's where you're going to get pain sensation from. So all of these things are involved with your nervous system. If you're having tension headaches, or if you're having migraines, your nervous system is involved. If you're having whatever types of headaches and problems that we're going to be talking about here, how they're related to your body and how your body expresses that pain or that problem is nervous system. And so Keep that in mind, that that nervous system is the master controller. The job of the nervous system is to help you integrate information from your senses and adapt to both your internal and external environment. Failure to do so leads to dis-ease. And that hyphen's there on purpose. I didn't mean to say disease, I said dis-ease. Dis-ease is just a lack of ease, a lack of usual function in your body, okay? So that doesn't always mean pain, it doesn't always mean things are breaking down and decaying. It means that your body is not functioning at 100% potential. Dis-ease then leads to disease, leads to breakdown, leads to degeneration. And it's important to understand that your nervous system integrates information from both your internal and external environment. So some headaches come from external sources, right? Stress, if the kids are screaming and crying and your job is stressful and your body's perceiving stress, or whether you got into something that you shouldn't be in. Maybe there's a sensory thing, like some people get headaches when they walk through the perfume section at a department store, right? So that's an external thing affecting your perception and affecting your body. Internal would be blood chemistry. Those of you who've been here the last couple of weeks, Dr. Hassel's talked a lot about inflammation and pH. How your body interprets that internal environment can cause a lot of headaches as well. Okay? Any questions so far? I know I kind of had to blow through a lot of that pretty quick, and it's a lot of stuff when you get into anatomy and nervous system anatomy. But I just wanted to, not even so much to understand how it all works, just to know that there are several layers anytime we get into these problems that you have to kind of think about. So let's talk about the types of headaches. Headaches have been classified into several different types and subcategories. And the interesting thing is every time I do more research and try to find more information on headaches, there's a whole new category and subcategories of headaches coming out all the time. And kind of the way the medical system works is, if they don't know what something is, they name it, and then they name subcategories of it. And so everything kind of has to have a name in their world. Ultimately, to us, it doesn't really matter whether it's named migraine or whether it's named, cluster headache or whatever. Obviously, we have to understand that there's relevance to those things, what type of headache you're having, but ultimately it's causing you pain, it's causing you dysfunction, we need to get to the bottom of it. So it doesn't really matter what the name is, but there's all these new names of stuff coming up. We're not even going to touch all of them, but I want to go over some of the most significant classifications. Literally dozens of named classes and subclasses, and all of this information, by the way, a great majority of it came right from the Mayo Clinic's website. So if you're interested in learning more about this, you can go to their website, and a lot of this basic information comes from it, and then a lot of things I've added to it. But a lot of the basic classifications, I just went right to their website because I figured they're going to probably be the preeminent source of, what's new, what the new classifications are. So a lot of this comes from Mayo. Tension headache. How many of you have ever felt like this? Mm-hmm. This is the most common type of headache that we see in our office, is tension headaches. Just because, especially as the world gets faster and people are trying to keep up, tension is huge. And we're seeing it in younger and younger people. And I've been practicing about 10 years, but already I've seen changes in the last 10 years. And it's really interesting because the more readily available we have to be all the time, phones and Twitter accounts and email and all these things, we're constantly in contact, and our bodies don't get a lot of rest anymore, and we're seeing a lot more of this tension headache problem. So I thought we would start with this one. A tension headache is generally a diffuse, mild to moderate pain that's often described as a feeling like a tight band around your head. A tension headache, or tension type headache as it's medically known, is the most common type of headache. So when people come in and they say, yeah, I just feel like everything is just crushed, like it's tight, there's this, my headache is here, then I know they're talking tension headache, okay? And a lot of it is because of, if we get into the signs and symptoms of it, it's this dull, achy head pain, sensation of tightness and pressure across your forehead, the sides, the back of the head. It's almost as if you had a headband on that's just too tight, or you were wearing a hat that's too small. That's what it's going to feel like. It's a real tenderness to the scalp. If people say, oh, it's just so sensitive when I touch, but it's all around, I get this whole thing. The most common area, though, for this is right in the back of the head, is where people will feel it, more of an occipital area. So usually when people come in and they say, I've got these headaches that all the time. Another interesting thing about this is they're usually going to be like late in the day, A lot of times people are going to have this because clearly you wake up in the morning, you've been resting, your body's been doing its thing, you're kind of getting going. But people will say, I get this headache every day around 2:30, 3 o'clock in the afternoon. It's right here. I know they're talking tension type headaches. Okay? Occasionally people will get a loss of appetite, but you don't usually see with this type of headache a real visceral response to the headache. Okay? Not a lot of throwing up or dizziness or eye problems. This is tension causing this. Tension headaches can last from 30 minutes to an entire week or longer. You may experience these headaches only occasionally, nearly all the time. If your headaches occur 15 or more days a month for the last 3 months, they're considered chronic. If you have headaches that occur fewer than 15 times a month, your headaches are considered episodic. It's really interesting to me when you start to look at that. It just makes me gasp a little bit to think that, and I know that you maybe know yourself or know people who deal with both of these types of headaches, but the one thing that I want to kind of hammer across tonight is there's no such thing as a normal headache or a regular headache. Headaches are bad. They're a symptom that something is wrong inside your body. So when people come in and they say to me, I'll say, well, what else is going on? Maybe they come in with low back pain or they've got these issues or whatever, and I say, what else? Do you ever get headaches? Oh yeah, but it's, I get my headaches. I get my daily headache. Or sometimes they'll say, yeah, I get headaches. I'll say, really? How often? Like once in a while? Oh no, every single day I get a headache. And they act like it's no big deal. Like, well, everybody I know gets headaches. I take Advil, I take aspirin or Tylenol, and these are headaches. This is a serious problem. As we saw, what, 24 to 26, $28 billion a year lost because of headaches? This is a big deal. And if your body's not functioning well and you're getting headaches, it's a serious condition. So obviously with tension type headaches, one of the biggest factors, of course, is stress. And getting rid of stress is a huge thing. It's a difficult thing to do. But you have to attack it first from that physical level. You got to get your nervous system integrated right. You got to get adjusted. You got to do those things. But sometimes it takes a life change, If you've got a job that's causing you, severe headaches more than 15 days a month for the last 3 months, it might be time to think about something different, right? So, and obviously that's not always an option, but there has to be options within that, ways to get rid of that stress to help get rid of those headaches. Again, it just kind of blows me away that people deal with this kind of pain on a regular level. Having been a chiropractic patient now for many years, I've had some significant injuries in my life, and I know what headaches are. I've had headaches. I've had my whole head taken apart in surgery. So I know what headaches are, but I don't suffer them regularly, and I know it's only because of my chiropractic care. If I wasn't getting adjusted regularly with the damage that I've had, not only to my skull, but my neck, I know that I would be suffering headaches. And as a matter of fact, if I go a little long between, I'll start to feel a little tension, and I can feel a little symptomatic pain coming up in the head, and I don't like it. So I know if you've all had headaches before or have had, you know what I'm talking about. Tension headaches can sometimes be difficult to distinguish from migraines. And this is a big thing that I've noticed lately, is any more people with headaches assume that they're having migraines. And we're going to talk about some of the biggest characteristic difference between migraines and tension type headaches, because I think years ago, 15 years ago, when I first started to get into healthcare, people would talk about migraines, and they were usually describing pretty classic migraines. But I think anymore, as the world's getting faster and people are trying to keep up, these tension headaches are so common, but a lot of people are calling them migraines, and they're really not. Not that you can't have migraines, but a lot of times it is tension. Tension headaches usually are not associated with visual disturbances like blind spots, flashing lights, nausea, vomiting, abdominal pain, weakness, or numbness, slurred speech. That's not a tension headache thing. So unless you're having those types of symptoms, you're probably having a tension headache. Physical activity typically aggravates a migraine pain. It doesn't necessarily make a tension headache pain worse, which is interesting to me, because if you're thinking about tightness and tension and all this stuff going on in your brain and in your body, you would think that then exercise would aggravate it. or make it tighter, but the reality is when you start to move your body and get some motion in there, things release. Adrenaline starts to flow in your body, the muscles relax, you're activating muscle spindles and Golgi tendon organs. Those are things that are communicating with your brain in a different way, and they're relaxing your body. So a lot of times when we say, if you've got a headache, go out and move, get some motion in your body, go for a walk, it does a couple of things. Number one, it's going to remove you from the source of your stress, hopefully. Get out and get some movement, get some oxygen going through your system, but oftentimes that exercise will help alleviate that headache. So it's a good first line of defense. You know, if you've got a headache, get up and move, get some motion in it. If it fades a little bit, odds are it's more of a tension type headache, and that could be just an indication that your body needs more movement. An increased sensitivity to lighter sound can occur with a tension headache, but it's not common, okay? Any questions about tension headaches? Migraines. This is a big thing because, like I said, anymore a lot of people that come in with headaches just assume that they're having migraines just because it's such a popular term. There are several types of migraine headaches, but most are characterized by severe pain on one or both sides of the head. It may move to the other side of the head, nausea, dizziness, visual disturbances, and it's caused by dilation and constriction of the blood vessels in the head. So typically if people come in and they say, I've got headache pain, and they start going like this, then I know they're probably talking maybe more migraine type pain. Remember, this one is tension headaches, this is going to be migraine type headaches, okay? Usually going to be one side and not the other. Again, not that you can't have headaches on both sides in a migraine, but it's usually not going to be both sides at the same time. A migraine headache can cause intense throbbing or pulsing in one area of the head and is commonly accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can cause significant pain for hours to days and can be so severe that all you think about is finding a dark, quiet place to lay down. So that's another big thing that I listen for when people come in and they say, I get these terrible headaches. And so right away I'm thinking, tension or migraine? Cluster, could be, let's find out a little bit more. If the next thing that comes out of their mouth is, oh, I had a headache so bad the other day, I just went in my room, took a wet cloth, put it over my eyes, shut off the lights, shut off all the sound, and just laid there for a day. Migraine. Okay? Typically people with migraines seek solace. They want quiet, they want still, they want very, very dark. And that's because of all this activity in your brain. Again, think about it from a nervous system component, okay? So the tension headache, you've got all this compression and this tightness. A chiropractic adjustment can release that tension. It can open the joints. It can get muscles moving. It can get blood flow restored. More importantly, it can get nerve system flow to restore. But think about this migraine. If you've got your brain so lit up and so active that all it's wanting is just to shut out all sensory input, if your body's overstimulated causing this migraine, a chiropractic adjustment can oftentimes help with that because adjusting can help funnel that passage of information through the spinal column. If you've got a joint that's not lined up correctly, and that joint is firing signals to your brain all day long, and there's tension on that vertebral artery, and there's tension on the nerve, and the disc is not healthy. Think about all this stuff coming into your brain. That internal environment is just screaming at you all day long, and what do you know? You wind up with these migraine headaches just from all this dissociation happening in your body. So in the same way, a chiropractic adjustment can help with a tension headache. It can really help with a migraine by settling things down, bringing that alignment back, helping the body to settle down. Stages of migraine pain. It often begins in childhood, adolescence, or early adulthood, and migraines may progress through 4 stages. The other thing that I think is of note of migraines is women are predominant migraine sufferers, more than men. I think it's like 4 to 1. Is most of the research I saw. So it's not that men can't have migraines, and they do, but women are far more common with migraines. I always think it's just because women are more multitaskers. You know, when I think about how my wife does things versus how I do things, I'm kind of a single attack and get things done, and she's got 50 things going on all at once. So again, if you're thinking about sensory overload and all this stuff going on in your mind all the time, to me that makes sense. There's also theories about, you know, how hormones affect your body and different things too. So clearly there's a lot going on when we talk about it. But typically we'll see these stages of migraine pain. The prodrome, the aura, the attack, and the postdrome. You don't have to experience all the stages, but a lot of times when people come in and they start talking about these stages of headache, I know they're talking migraine. So we'll talk about them a little bit here. The prodrome, It's usually 1 or 2 days before the migraine. You might notice some subtle changes. It could signify an oncoming migraine. So some of those symptoms could be like a constipation, depression, diarrhea, food cravings, hyperactivity, irritability, neck stiffness. The key isn't necessarily the symptoms, it's that you're experiencing something that's not right a couple days in advance. I have a lot of migraine sufferers that will tell me, I can tell if I'm going to get a headache in the next day or two. They're experiencing the prodrome. Their body knows something is wrong. And I think that that is so key, because if those people come in and get adjusted during that prodrome, we can avoid a lot of these migraine headaches, because, again, your body's signaling to you without blowing up this big headache. It's telling you, hey, we're seeing symptoms, the body's flushing. So like, let's say you've had a lot to eat, or your body's got something in that it's not digesting well, or you're chemically toxic. Your body may go ahead and just have some diarrhea and get rid of this stuff and try to flush. It's trying to flush the internal environment and clean you out, and if it can't get the job done, you wind up with this toxicity in your body, and that can lead to these headaches. A particular food craving. Maybe your body's missing some essential nutrients and it's not getting it. You know, like think about pregnant women. You know how they crave weird combinations and stuff? A lot of times it's because they're cooking this little baby inside that needs essential vitamins and nutrients and minerals, and if the body isn't able to give that, it'll make you hungry for them. Even if it's pickles and ice cream weird, your body will ask you for things, and if you're paying attention to it, oftentimes you can get some of that correct nutrition in and maybe even help stave off some of these headaches. That's why kids in like third world countries eat dirt, right? You see that a lot, because they're missing like iron. They're so iron depleted in their body, they'll eat dirt. Lots of kids do. So your body's very smart. It knows where to get what it wants. It knows how to get what it wants. So pay attention to these things. And if you're seeing, you know, a couple of days out, this irritability, these cravings or diarrhea or issues that's unusual for you, it could be prodrome. Aura. Most people who experience migraine headaches without auras, but an aura is like a visual sensory thing. So it's usually visual, but it can be a sensory, motor, or a verbal disturbance. Each of these symptoms typically begins gradually, builds up over several minutes, then commonly lasts for about 10 to 30 minutes. Examples include like a visual phenomena. This is probably the most common one that I hear of, like seeing flashes of light. Like if you close your eyes even, there's these flashes of light. Sometimes people will even talk about like they're looking at somebody and like there's light around them, or there's this halo, or these weird light things. That's very typical of aura. Vision loss, tunnel vision is the most common one there. People will start to feel like the world's kind of closing in on them and they can see this tunnel. That's very common. A pins and needles sensation in the arms and legs, or speech or language problems can also signify aura coming on. The attack itself, when untreated at this point, or if it's not taken care of, or if you're not doing the right things or progressing the right direction, the migraine attack, the time where you're hurting, can typically last from 4 to 72 hours. And I've talked to a lot of patients over the years who get like the 2 and 3 day migraines, where they're in their bedroom, drapes pulled, you know, dark, cool, trying to rest for sometimes a couple of days. The frequency with which headaches occur varies from person to person. You can have migraines several times a month, or far less frequently. Sometimes a migraine sufferer might get 2 a year. Sometimes they might get 3 or 4 a month. During a migraine, you may experience some of the following symptoms. It'll be pain on one side of the head most commonly. It's going to pulsate, throb. Remember that tension headache is that tight grip, it's that tension. That boom, boom, boom throbbing is more indicative of the migraine. Sensitivity to light and sounds, sometimes smells, nausea, vomiting, blurred vision, diarrhea, lightheadedness, sometimes fainting. So these are things that are pretty common with migraines, whereas again with that tension headache, you're not going to have that stuff. You're not going to lose your lunch for a tension headache, but for a migraine sometimes you will. Anybody here know somebody who suffers from migraines on a regular basis? Pretty common. Postdrome, the final phase known as the postdrome, occurs after a migraine attack, when you may feel drained, washed out. Some people report feeling mildly euphoric. And I think the reason for that is if you've been hurting on an intense level, when that finally releases and your body starts to regain control, I would think you would probably feel a little euphoric about that, a little happy, you know? So it's like a physical letdown. I always tell people it's kind of like, you know, if your child was getting married and after the wedding, like the next day, there's this, you know, this big sigh of relief, or you had a big project and it's finally done, you're going to get this physical letdown. And that's sometimes what we see with a postdrome. Any questions?
Yeah.
Go ahead.
Can you get migraine headaches in your eye when there's a lot of pain in your eye, or is that a different type of headache?
It's probably a different type of headache, but it doesn't mean that you can't. Migraines
Where
are just...
it does a lot of the things that you're talking
Sure.
migraine, but it's
Yeah.
a lot of pain in the eye.
Yeah, it is possible. That I did read about that sometimes people will have, because it's a visual disturbance, it's all this stuff, but typically if it's one-sided, that's the big key.
Mm-hmm.
Yeah. And so if it is one-sided, but it's right behind the eyes, absolutely that can be migraine related. Yeah.
Okay.
I've even heard the term ocular migraine. Have you heard that term? Like an eye migraine. That's something I've heard from eye doctors before too. So maybe that's what they're kind of talking about, is that visual disturbance and that pain right behind and inside the eyes even. Any other questions?
Yeah.
Yes?
I get the aura of the migraine.
Mm-hmm.
You know, my vision gets the, you know, you have the kind of the Z-shaped thing with the flashing lights, and
Oh, wow.
you know, I can't read or anything.
Okay.
But then the actual pain doesn't really come. I get, you know, maybe just a very light headache. Is that still the same thing as a migraine, the same cause?
Yeah, I would say that it could very easily be. If you're getting that kind of flash and that sensation and that aura, absolutely, then the expression of pain may just be different for you than what it is for some people. You know, like it said, some people only get maybe a 4-hour, you know, but the intensity of pain or your threshold for that pain may be different too. You know, it's another thing to keep in mind is what puts somebody down for 72 hours might be a speed bump for somebody else. It just depends on how your body interprets that pain.
But it doesn't happen all that often. But you know, whenever it does, I'm always like bracing myself, because our son gets the bad migraines where he would, you know, shut himself in a room for 3 days.
Right.
So I'm always waiting for the pain, but it never really comes. I don't know.
Yep.
If that's the same thing. Or?
It could very well be, and your body just expressing it differently, you know. And maybe your body has a little bit better defense mechanism built in. You know, if you're getting adjusted, if you're taking care of your spine, and your body has a capacity for adaptation, it may be that when those signs are coming on, that your body is releasing some of that pressure or changing.
Do you have any idea what brings that on? I mean, it's just so random. It's just, you know, comes whenever.
Right. Again, I think the biggest component of that is stress and how your nervous system is integrating that stress. So I still think that's the biggest thing, you know. I know for my headaches, from what I've had in the past, that tension is a huge precursor to those types of problems. And I'll talk to a lot of migraine sufferers that say the same thing, like if they're especially stressed, lack of sleep can be a huge one. So those types of things can bring that on, but then that pressure in, especially like in the cervical spine, that vertebral artery, how it delivers blood to that part of your brain is a huge factor in that. Yeah.
Other than chiropractic, which obviously, yeah, we need to get adjusted,
Mm-hmm.
and maybe you're going to answer that later on, and if so, feel free to wait. But is there any other things that you can do to help with headaches?
Yeah.
And maybe you're going to, I don't know if you're going to talk
Yeah,
about
we'll
that.
touch on that a little bit, but it's okay to talk about it right now, and that's why I love that we're doing this series of talks, because I think one of the things to think about is being proactive with them. You know, reactive to headaches is tough, because by then the damage is done, the problem is there, that your body is reacting to that. So obviously adjusting on a regular basis is critical to keep that nervous system balanced. But then you have to think about things that Dr. Vince has been talking about in his talks here lately. What's your pH been? What's your acidity? Are you acidic? What's your metabolism doing? How are you digesting food? What have you been eating? And what's your inflammation reactions? You know, so I think if you really want to get after it, going at it from a proactive means is really critical. Now, if you're talking about response, some people get really good response from things like acupuncture as well, you know. Sometimes that type of stimulation can help alleviate headache pain as well. So I've seen patients that respond really well to acupuncture in addition to chiropractic, or, you know, alongside of it. Clearly, when you talk about medication, we're going to talk about meds here in a little bit, and one of the headaches that's associated with medication, but that's just all just dulling senses, you know, just shutting down the pain receptors. So I think if you're really wanting to know an answer to that, I think it all has to come proactively, you know.
Because when I get a headache, a lot of times I'm icing. I'm putting ice and you know, on the back of my neck or on my back or whatever. or back of my neck, and drinking water.
Yeah. Yep.
So I didn't know.
And there you're doing two things specifically. Number one, when you're putting water in, you're increasing your blood volume a little bit, which is going to help open up those blood vessels a little bit, get some more blood volume in there. But you're also going to help to flush toxicity out of your system with that water, which is a great thing. The coolness or the ice, of course, then can cause a little vasoconstriction, so it can settle the muscles down. It can get some of that blood to constrict. So that can be very effective for certain types of headaches as well.
Yeah, I didn't know if there was anything else that you can do to help alleviate the.
Yeah, those are big things. But again, I think if you really want to be serious about it, being proactive is the best way. Changing your lifestyle. Obviously, if you have to think about ergonomics. How am I sitting at work? We talked about that a couple weeks ago when I did my last talk. Ergonomics and how you sit can be huge, especially for tension headaches. If you're sitting like this all day at a computer, or worse yet, your monitor's here, your keyboard's here, and you're doing this all day in this bad posture, or you're working an assembly line that you're working down all day, that's going to cause lots of reactions and tension in your body, which can cause headaches. So lifestyle changes are huge, but then regular exercise and being proactive with working with inflammation, taking the omegas and getting your pH up where it belongs is huge. Because the way your body reacts to things like food and air and toxins in our systems is very, very important. Yeah.
Thank you.
You're welcome. Any other migraine headaches or comments or questions? Okay, let's talk about cluster headaches a little bit. Cluster headaches occur in cyclic patterns or clusters, which gives the condition its name. Now, here's what I want you to understand. The cluster headache is one of the most painful types of headaches. When we have people, it's very rare that I get patients in who are suffering from true clusters. Clearly, tension headaches are the most prevalent and most common, migraines being second. Clusters are rare. I think in 10 years, I've maybe had a couple of cluster headache sufferers. These headaches are intense. As bad as a migraine can get, this is worse. Cluster headache is sometimes called the alarm clock headache because it commonly awakens you in the middle of the night. That's a big thing with this, A lot of times people will wake up with a headache at their normal time, but if you're waking up from a headache because it's so intense, could be cluster headaches. The big thing around this is intense pain around one of the eyes or the side of your head, but it's a bout or a frequent attack, known as cluster periods. It can last from weeks to months, usually followed by remission periods when the headaches stop completely. That's important. If you're getting like boom, 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 boom headache for 2 or 3 months, and then all of a sudden you're headache free, and you haven't done anything to alter your state, it could be a cluster headache. The other interesting thing to understand is during remission, the headaches occur no headaches occur for months or sometimes even years. Sometimes people will go and have headaches for 5 years, and then all of a sudden, boom, they're back again. And that can be typical of a cluster headache. Again, fortunately, these are rare, and also, fortunately, they're not life-threatening. But they'll feel like it. If you get a cluster, or you know somebody who gets clusters, they're in pain. This is real pain.
What would cause it? Because I think I've actually suffered this from a couple of times. One time I had to go to the hospital. I was just couldn't. I mean, it was bad.
Again, I think that the biggest thing about this is help understanding the underlying tone of the nervous system is so huge. I think it can cause all of these. And ultimately, when we get down to it, you're going to find out that I think that this is the cause for all of them. Okay? There are other factors that can then irritate that, but again, your nervous system is the part that integrates sensation from the internal and external environment. If you're getting pain, headaches of any kind, your nervous system is directly responsible for that. So if you've got pressure in your nervous system that's not supposed to be there, these are the types of symptoms that we're going to see. And I think that this is a huge, huge factor. Again, then we also have to think about things like chronic inflammation and swelling and pH and ergonomics and all these different things and dehydration. But I still think that the nervous system is far and away the most important aspect. I'll have people sometimes say to me, well, I get migraine headaches because my mom got them. Well, I think that genetics are important, but I don't buy it. If you're getting the same problems your mother had, it's probably because you live the same lifestyle, eat the same food, have the same exercise habits, those types of things, I think that's a big factor in some of this genetic stuff that comes in. Now, clearly genetics play an important role in how we're put together. So could you have a particular chronic weakness because of the way your body's set up genetically? Obviously, my muscle system is going to be slightly different than yours or yours, and that's all based on the expression of our genetics. But what we do with that genetic code then is really is primarily up to us. Because I also have people that come in that I've got, for instance, I've got twins, patients that are twins, exact same genetic code, and one of them suffers migraines and the other one doesn't. So it can't always be just about that. It's about the expression of that code. Symptoms of the cluster headache, again, real quickly, it's excruciating pain. If you have one of these, you're probably going to know it. One-sided pain, again, like a migraine. Restlessness is a big one with this. One of the big things that I want to highlight to you is this restlessness. That's a big deal. Migraine sufferers, when they get a one-side headache and it's intense and severe, they're seeking solace. They want to go lay down. They want to get away from sound, away from noise. A cluster headache person will get up in the middle of the night and start getting around. That restlessness, they're going to be fidgety, they're going to be moving, they're going to be looking for stimulation. That's not what you're going to see with a migraine. This is people that are looking for movement. Excessive tearing, redness of the eyes, stuffy or running nasal passages, sweating, pale skin or pallor, swelling around the eye on the affected side of the face, reduced pupil size, drooping eyelids. You could think you're having a stroke with this, right? So if you start getting this droopy side and this whole thing going on, it could look a lot like Bell's palsy or a stroke. Okay? It could be a cluster headache. The pain of a cluster headache is often described as sharp, penetrating, or burning. People with this condition say that the pain feels like a hot poker being stuck right in their eye. The eye is being pushed out of its socket. People with cluster headaches appear restless, preferring to pace or sit and rock back and forth to soothe the attack. So again, it's that motion. They're looking for stimulation, something to overcome this. And I think the reason for this is what has to do with what's called the gate theory of pain. In other words, your body is going to have certain signals sending through it, and if pain is a primary signal that's going through it, if you can activate other signals and receptors in your body, it'll overcome some of those pain signals. So it's kind of like if you're nailing a nail and you hit your thumb, what's the first thing we do when you hit your thumb with a hammer? Right? Everybody does this. It's just instinct. Because when you do this, you're firing all these muscle receptors and all these joint mechanoreceptors, and they're clogging the pathway of pain. So basically, then when you stop again and you look at that thumb and you focus on it, that thing will throb and pound like all get out. You start going like this and you look away and you start whistling or whatever, the pain lessens. Well, the pain didn't lessen, it's just that you're crowding out that pain signal. So I think with these cluster headaches, that's what people are looking for. They're looking to activate their body, get some more sensory input going so that they don't feel the pain as much. So you're basically just tricking your body to not pay attention to the pain, you know? It's the old, well, if you got a headache, I'll kick you in the shin, right? You'll feel that shin pain. So we should do that to somebody with a cluster headache, though, because that's just not nice. Vascular headaches. Anything more about cluster? Sorry, I kind of blew through these a little bit. But.
Out of curiosity, that you said there was excessive tearing. Mm-hmm. Can you get that in migraine also?
I would imagine if you're having that headache around that area and there's a lot of pain in there. I didn't really see anything about that particularly though, but this was a prevalent thing about those cluster headaches, is that excessive tearing is a part of that.
And is that after a while or immediately?
Not necessarily. Probably. Well, I wouldn't say it's necessarily that first instant, but probably after a few moments that your eye would tear and swell and redden. And
out of curiosity, is there such thing as like a sinus headache that would do the same type of thing?
We're going to talk about that in just a second.
Okay.
Yep. Vascular. The term.
Sorry.
That's okay. It's a great question, and we'll get to that. The term vascular headache refers to a group of headache conditions in which blood vessel dilation or swelling is the major component. Okay? Blood vessels in the tissues surrounding the head swell, become distended and inflamed. It's a normal pulsation of the vessels that cause this throbbing type of pain. So if you're talking about this pounding pain, but let's say this pounding pain is on both sides of the head instead of one, because remember pounding pain is a sign of migraine, but if it's on both sides of the head, it may be more vascular. Okay? That could be blood pressure issues, that can be toxic issues in your blood, different things like that can be causing this dilation. Caffeine headaches can sometimes cause the caffeine and reaction to caffeine can sometimes cause these vascular types of headaches. Vascular headaches are usually throbbing in character. Physical exertion increases the pain, which makes sense, right? If you've got this dilation and this pounding, pulsing head, and all of a sudden you increase that by physical exertion, it's going to pound more and get worse. Included under the classification of vascular headaches are migraines, clusters, toxic headaches. It all involves dilation or swelling of the blood vessels. So really, vascular is kind of a bigger subset of headaches, and some of these other ones kind of fit in with the vascular headaches. So there can be vascular components of these other headaches. And that's why you're seeing kind of similarities there. Here's the sinus headache, okay? Sinus headaches are headaches that may accompany sinusitis, okay? Inflammation in the sinus cavities in the face. A condition in which the membranes lining your sinuses becomes swollen and inflamed. You may feel pressure around the eyes, cheeks, and forehead, and perhaps your head throbs. Although these can indicate sinus headaches, big red letters, don't jump to conclusions, right? Many people who assume that they have sinus headaches are actually having migraine or tension headaches, okay? One of the things that irritates me, well, I shouldn't say irritates me, but I see it so much that people are coming in and they're getting treated for sinus headaches all the time. Antibiotics, 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 antibiotics. I think a lot of times it's a misdiagnosis. And I think the problem is when people come in and they say, Doc, a medical doctor, and they say, I've got all this pain right here. Oh, and my nose is running a little bit, but I've got all this pain right into here. I think sometimes they're jumping to the conclusion that pain here must be sinusitis. It doesn't necessarily have to be. It could be a cluster headache. It could be a migraine headache. Antibiotics are not going to be effective. So one of the things I want you to understand about that is, I think that's supposed to say air, not in. Air or pressure or fullness in the cheeks, brow, or forehead. When you have a true sinus headache, the pain may worsen when bending forward or lying down. So if you're like, again, if you're seeking that solace and you're going to lay down, you're not having a sinus head, or you're probably not having a sinus headache, because if you're full up into here and you're all inflamed and you lay down, that pressure is going to increase. It's not going to feel good to lay down like that, like a migraine would. The other big thing is you could and will likely have a yellow-green or a blood-tinged nasal discharge. So in the absence of some of these things, treating it with antibiotics is really kind of ridiculous, right? Because if you're having a migraine headache or a cervicogenic headache, neck pain causing headaches, and you take an antibiotic for that, number one, it's not going to fix the problem, right? Because it's an antibiotic, it's not a pain reliever. Secondarily, what antibiotics do to our body is they flush out all the normal flora in our gut, so now we're not digesting food correctly, our pH gets screwed up, our inflammatory response goes up, and we get more headaches. One of the things that irritates me about this, when I said it irritates me, is when I see people that get sinus infections, they seem to get cyclic sinus infections. They get treated, 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 and they never ever get better. And that really bothers me that they keep putting these antibiotics into people when in reality they're not going to help anything by that. An antibiotic is not going to make that pain go away. Sore throat, fever, cough, fatigue, achy feeling in the upper parts of the teeth, that's more commonly sinus stuff. Okay? And I think unfortunately a lot of times people go in and they say, hey doc, I got a sinus headache. So they're going to get an antibiotic as a treatment, you know. Whereas the person may not realize they're actually having a migraine, or they're having a cluster headache, or they're having a tension headache. It's important to note that it's possible to confuse migraines and sinus headaches because the signs and symptoms of the two overlap. Studies have shown that 90% of those with sinus headaches actually have migraines. Okay, so when people come in and they tell me that they have a sinus headache, probably not. It can happen, but it's rare. And so that's one of the things that I thought was so important about this class, is understanding these distinctions. Because when you come in and you say, well, I've had sinus headaches ever since I was a teenager. Well, you've probably had migraines ever since you were a teenager, and you've been misdiagnosed and mistreated. And that's why it's important to understand some of these distinctions. Or if you have a child at home that's having these problems, don't rush to the antibiotics. Don't rush to the medical doctor. Get adjusted. Let's look at GI tract. Let's look at inflammation. Let's look at pH. Let's look at some of these things. Yes, Mark?
What if you have the discharge, the yellow, the green, yellow, or achy teeth? Can you assume that that's a sinus headache and take antibiotics then, or not?
Certainly, it's more likely. The interesting thing that I read more and more about sinuses and also like ear infections is that the 10-day turnout, whether you do an antibiotic or not, is about the same. So will an antibiotic shorten that life cycle of that infection? Probably yes. But the problem is, what they're doing, especially in research in like children with ear infections, one of the #1 precursors for having an ear infection is whether or not you've previously been treated with an antibiotic. So the problem with that is if you take an antibiotic to knock out that sinus infection, what you're probably going to wind up with is more sinus infections. Because, again, it kills all that normal flora, and now instead of having all normal bacteria in your body fills up with all this nasty stuff. And so I would really caution people to jump to antibiotics unless it's really, really getting out of control. You know, if you're looking like you could become septic, obviously you need to do what you need to do. Or if it's a really seriously chronic long-term discharge, maybe, you know, then maybe an antibiotic is relevant. But so many more times, I think if you can get people to eat correctly, get them adjusted, and get some of that drainage out naturally, I think you're going to have better results. And then the big thing then is getting people to eat that non-inflammatory diet that Dr. Hassel talked about. If any of you weren't here the night he talked about inflammation, that inflammatory diet is so important, because if you're eating lots and lots of dairy and lots of this stuff that tends to cause inflammatory reactions, if you think about what sinusitis is, it's inflammation of the nasal passage. So if your body has a general inflammatory reaction, that's going to be something that's going to happen, or you're going to see more. Yeah, great question. So more than likely, people that have chronic inflammatory conditions are from unregulated pH, inflammatory diet, no exercise, smoking, and vertebral subluxation. So that's a big reason for that. Again, I just want people to understand that if you're taking an antibiotic for an infection, especially ears or nose or upper respiratory type stuff, that's probably going to be a big precursor for you having secondary infections. So, rebound headaches. Have anybody? By the way, it is 7. If anybody needs to leave, I won't be offended. I know I'm kind of running just a few minutes long, but if you need to leave, it's perfectly fine.
The reason why you're going long is because of us, me asking questions.
Oh no, it's great. That's how we learn questions, and it makes me think too. It's good. Have any of you ever heard of rebound headaches before? Have you ever heard of this term? You're going to hear more about it as time goes on. Rebound headaches are what are called medication overuse headaches. They're caused by the frequent use of headache medication. Pain relievers offer relief for occasional headaches, but if you take them more than a couple of days a week, you may trigger rebound headaches. That's Mayo Clinic verbiage, not mine. Okay, so I'm not saying pain relievers may offer relief for occasional headaches. Clearly, that's not my belief. That's Mayo Clinic's belief. But they're here recognizing. You know, have you ever looked at a bottle of Advil? If you go to the store, because clearly we don't have that in our homes, right? So you have to go to the store to find a bottle of Advil. But pick it up and look at it, and it'll say, do not take for more than 10 days. It says it right there, not without consulting your physician. And I think so many people think if it's over the counter, it's safe. I can just take this thing. So here's how this works. If you have a rebound headache, what they're talking about is people who have had a headache, tensions, migraines, whatever the cause of their headache might be. They might be toxic, whatever, they've got these headaches. They start taking this level of medication. Well, pretty soon your body wants you to it wants your attention, because something is wrong. A headache is not normal no matter what kind it is. So what it does is it elevates the level of pain. You're going to get more pain receptors firing. So what do? You take more medication. Your body elevates the level of pain, you take more medication, it elevates the level of pain. Pretty soon you get to a point where the medication is causing severe problems. Let's say it's causing ulcers, or it's causing problems in the kidneys or the liver because you're on so much of this NSAID medication. You try to get off this medication, and your headaches are so completely intense, you can't hardly stand to be without the stuff. That's called a rebound headache. So oftentimes people that are controlling these headaches with NSAIDs and over-the-counter stuff, when they try to quit taking it, they'll get this intense withdrawal headache. And that's really what it is. It's kind of like a withdrawal. Like when you hear people coming off the more serious drugs, how their bodies will become pretty violent. This is that kind of headache. Your body's saying, hey, you've been treating me with this for the last months, years, whatever, and now all of a sudden it's absent in me. Then the headaches are intense. So these can get really bad, and they can be a big deal. Depends on the type and the dose of the drug, frequency of the headaches. For instance, opiates, rebound headaches may occur after 8 days of use in a month. So an opiate-style pain medication, you may only have to take for 8 days before you start getting rebounders, which is a big deal. Barbiturates may only take 5 days of use in a month. So we're not talking about long-term use for some of these drugs. Now, opiates and barbiturates, of course, they're pretty heavy medications. You're not buying that over the counter. But even prescription pain medication causes this stuff. So think about what it means. When they said, the Mayo Clinic says, this happens because your body adapts to the medication. Think about what that means. Your body adapted to medication. A pharmacological change happened in your body, and your body got used to it. Think about what that takes to adapt to a medication. Think about what we know now about pH and inflammation and how your body responds to things. What does it take for you to get used to something that your body is absolutely not supposed to get used to? What has to change in order for you to think that that's normal? That's a big deal. So when your body starts adapting or getting used to medication, you got problems because you're not supposed to have that stuff. And clearly nobody ever had a headache because they didn't have enough Tylenol, right? I've never heard of that happening. Your body is not designed for Tylenol. It's not supposed to have Tylenol. I saw a Canadian study once that said that 80% of the people on dialysis are there because of Tylenol and related NSAID drugs. So kidney failure is going to be huge, and the more we see these headaches and tension and stress, and the sales of these NSAIDs and over-the-counters are going up, you're going to see an awful lot of your friends and cohorts going to be on dialysis when they get older. It's destroying their internal environment. And I often tell people, if you're taking that stuff, you just well be swallowing ground glass because it's just going to tear up your insides and cause ulcers. I've seen teenagers with ulcers because of things like Tylenol and NSAIDs, so you don't even have to be very old. Recent research, it was April 10, actually, that this research study was put out, 2012. Approximately 2 million Americans suffer from rebound headaches. There's the website if anybody wants to see it. It's called migraine.com. It was the most recent research I could find. So yeah, that was 14 days ago, 2 weeks ago it was released. So approximately 2 million Americans suffer from rebound headaches. So this is a big deal. But if you think about the number of people, and that's what's reported. Think about how many people who are getting rebound headaches and don't know what it is. Or they just aren't diagnosed, or they don't know that that's what it is. So it's probably much, much greater than that. Rebound headaches should be called medication headaches. That's what's happening. I kind of talked about this, so I'm not going to go over it. But when you take less or no medication, the pain triggers in your body are so elevated, the pain returns, and it's the removal of the medication. So it's all about threshold. It's about raising that level of pain all the time until your body just can't tolerate it. Other headaches of note, we're almost finished here. External compression, so that would be like if you wore swim goggles, headbands, hats, football helmets. I once had a motorcycle helmet that I had when I was a kid, and I went on a motorcycle ride as an adult, and I wore the same helmet, not very smart. I took it off, and of course I got this pounding headache because you're compressing your cranial vault. No wonder you have a headache, right? External compression can cause those kinds of headaches. Most commonly you're going to see that in like headbands. Or women that pull their hair back in a ponytail sometimes get headaches because there's all this sensation or the headband is too tight. Oh, the ice cream headache. Everybody have an ice cream headache at some time in their life?
Brain freeze?
Yeah, the brain freeze, right? Pain associated with eating or drinking cold foods or liquids, agitation of the trigeminal nerve, or cooling of the blood in the stomach. These are possible causes. We don't really know exactly for sure what's causing this, but I think this is what it is. The trigeminal nerve is a nerve that has, it's one of the cranial nerves, but it has roots of effect in the neck. And agitation of that nerve is going to cause facial pain and headache pain, temporal pain. Again, if you cool all that stomach and all that blood's coming up through the stomach and coming up in through your brain and you're getting this cooling effect in here, certainly that can cause it. Usually waiting a few seconds, it goes away, of course. Sex or exertion headaches. When I first saw that, I thought that was like the kind of headache that people say, no, honey, not tonight, I've got a headache. Like that kind of headache, clearly that's not what it means. That's just a bad joke. An exertion headache is clearly when your body exerts a lot of energy and you get a headache. It's a vascular headache primarily. Okay? Thunderclap. This is one I want you to know about just because you're never going to have one, and if you do, I hope you get to talk about it. But a thunderclap is an unusual or intense and extremely severe pain. It starts in seconds and usually fades in an hour, but it can last a week. This is a medical emergency. This is the kind, they call it a thunderclap because if you ever get it, you will know it. It's not that you're going to hear the boom, but that's what it's going to be like. It's going to be like this bang, inside your head, and it's going to be intense, like get on the ground right now pain. Even worse than cluster. Oftentimes it means that you're bleeding inside your brain, okay? When we talked about that circle of Willis and where those arteries go, if you get this kind of headache, do not ignore it, okay? If you want to come here and have us send you on, that's fine, but if you get that kind of a headache, if we suspect that you're bleeding inside, we're going to send you across the road. You know, that's got to be evaluated. You got to do an MRI, got to do a scan, find out what's going on, a CT. But I've never seen anybody with this, not in 10 years. So I hope I never see anybody with this. But it's good to be aware of, just because if you have a friend or family member that says, man, I got knocked out with a headache, and it's, you know, faded like an hour later, it was gone. They could still be bleeding inside there. So it's important to know. And then again, a toxic headache. Use what you know about inflammation and pH to understand what a toxic headache is about. Think about a hangover, okay? So you go out drinking and you get dehydrated and you got all this sugar, this alcohol sugar in your body, and your body becomes toxic. That's where the headache comes from, and primarily it's dehydration. But when you get all this toxic stuff in your body, it takes a while for the system to filter that out, and dehydration is a big part of that, because when you drink alcohol or too much caffeine even can be this. It shuts off the loop of Henle in your kidney, which is the filtration system in the kidney, and your body just starts peeing everything out, because your body's saying, okay, this is no good, I got to get rid of this stuff. So rather than trying to filter it and keep up with it, your body just opens it up and says, get out of here. And that's why a lot of people, when they drink, they get really dehydrated. So making sure that if you've had a little too much to drink at night, last thing you might want to do before you go to bed is drink a couple of glasses of water, just to make sure that you're appropriately hydrated. And not that I want to just give away secrets for how to avoid a hangover, but you know, sometimes if you go out and you have a couple of drinks and you want to avoid that, putting a little bit of water in your system that night yet can be a big help. Spinal subluxation and headache, it all goes back to that master controller of the body. The nervous system has direct or indirect control over every function of the body. If you understand how spinal stress and nerve compression affects the human body in great detail, you can understand how subluxation is a significant component in every type of headache. Okay? If you've got nerve system interference and your body's not functioning at 100% and you're not regulating your internal environment, can that cause a toxic headache? Yes. If you've got tension in your muscle systems because your muscles are firing inappropriately, because your nervous system is in control of every action and movement in your body, can that cause a tension headache or a migraine? Absolutely. If you know people with headaches, they need to be getting adjusted on a regular basis. It's just that simple. If you have headaches, you need to be getting adjusted on a regular basis. If you're getting adjusted and still having headaches, clearly you need to look at the other components, right? Like we always talk about around here, you got to move well, think well, breathe well, eat well, sleep well, and have functional control of the body. So there's all these components, and that goes back to what we were talking about earlier, being proactive, making sure that you exercise every day, not 3 days a week, 7 days a week, making sure that you're getting motion, making sure that you're getting enough rest or enough sleep. If social stimulus is too much and your job is too much, maybe a lifestyle change is appropriate for you. Maybe thinking about taking up something that's relaxing, you know, prayer or meditation or yoga or whatever it takes to get you breathing and moving well is appropriate, along with the chiropractic care, of course. Any questions?
I have a question.
Yes.
Our son occasionally gets migraines, especially if he doesn't get a lot of sleep. And he is about to be deployed to Afghanistan. And they'll be in a really remote area. Okay. So I'm just wondering, is there, and you have any suggestions as to what he could do if it happens?
Yeah.
You don't have access to, you know, a lot of things.
That is going to be so tough, just because, and one of the probably the biggest factors over there is going to be the heat. It's one of the big things I hear about soldiers coming back from Afghanistan.